I did my presentation in my paper on the importance of good prenatal nutrition. Prenatal nutrition is the nutrient recommendations before and during pregnancy. The nutrition and weight management before and during pregnancy have a significant impact on the development of the fetus, because the developing fetuses rely on their mother's body for a home for the first 9 months of life. They rely on their mother's food intake to get the nutrients they need to properly develop. Children and infants develop many problems that can be traced back to mother's poor prenatal nutrition habits, and good prenatal nutrition will raise the chances of healthy offspring and will prepare children for a lifetime of health. It is important for mothers to add things to their diet and consume a well-balanced diet containing micro and macronutrients. Micro is like the nutrients you need in small amount, macro is in big amount. And for some examples, a zinc deficiency can cause decreased antibody concentrations. Deficiency in folic acid is related to intestinal inflammation and poor spinal development. Getting enough vitamin A, D, and E will help with the fetal immune system. And mothers should get enough protein so that the child's pancreas can fully develop. So that helps reduce the chances of their offspring developing diabetes or obesity later on in life. And just as important as adding things to the diet, mothers should eliminate harmful substances like alcohol, drugs, certain medications. And there's even stuff like too much vitamin A can cause malformations and birth defects of the infant. So cannabis use, or weed, is the most commonly used drug among women of childbearing age. And the children that are born to women who have used cannabis, they have fine tremors and they startle to mild stimuli, and after birth they have problems with their attention. Cocaine users, they have lower birth, the babies come out with lower birth weight, smaller head circumference, preterm birth, and poor physical formation. They're jittery. They have tone abnormalities, iron deficiencies. They have heart problems. They have abstract processing and an underdeveloped brain. And that leads right into opioids, which has similar things, but it also increases the chances of SIDS, sudden infant death syndrome. It also causes seizures, lower cognitive function, and can cause behavioral problems in the child later in life. Alcohol, the big thing for that is fetal alcohol spectrum disorder, and that causes deformations of body, and alcohol can also cause behavioral problems and physical disabilities of the children. Prenatal and preconception nutrition affect not only the child, but future generations. Over and undernutrition could lead to a greater chance of developing obesity, and prenatal nutrition affects the developing brain. So it's very important to follow good prenatal nutrition guidelines. And then following those guidelines will help reduce the chance that offspring will have nutrition-related diseases. And we have the power to prevent these unnecessary health issues, and we need to be able to inform everyone, especially mothers, to receive the necessary care and understand the importance of their decisions they make during this time. Mothers must follow prenatal conception nutritional guidelines to increase the chances of a healthy baby. As a society, we need to raise awareness about the importance of good prenatal nutrition. We need to provide ways for the mothers to access their nutritional needs during pregnancy.